So Severance, thanks for joining us today.
Well, Patty, thanks for having me. I'm really excited to be here at HIMSS AI.
Yeah, so let's talk about disrupting the disruption and change the course of patient care. What should healthcare organizations consider when procuring AI solutions?
Yeah, I mean, it's apropos, right? So if you had asked that question a year ago or 2 years ago, it's really about the healthcare organizations building in-house. And now they have the option of buy versus build. And when you're looking for that solution and you're not going to build it internally, you need to make sure that there's a track record in the solution. Does it drive precision? Does it have the biological validation? So our solution was the first to be biologically validated. So through EMR records, lab tests, and things of that nature. So you need to make sure that's working. The second thing you need to think about is, how do you operationalize this? So how do you as an insurance company put this through your care management or your medical director and drive those results for, let's say, decreased hospitalizations? But if you're a provider, and maybe you're a provider at risk, how are you decreasing your costs and increasing your ability to deliver value-based care? So those things you have to evaluate. And then number 3 is, if I'm going to build this myself and we've made a decision not to buy, how far behind are you? But also, you have to have the right people, the right data scientists who are healthcare oriented. Number 2 is you have to have access to the data. So the people around HIMSS usually do. But then you have to dedicate those individuals to actually do the work and develop it. And they can't be on side projects, with a daily plate full. So they have to be completely dedicated. So in terms of what we did, we spent 4 years in R&D. And part of that, Patty, was luck, right? Access to the right data, because we wouldn't have to. So
great. So how do you see AI impacting value-based care?
Yeah, I mean, value-based care, what is that, right? I always like to say is, and I'll be talking about that a little bit later, is it's a squidgy term, right? But if you boil it down, is if our providers or the insurance companies direct care and drive better results, people get healthier, they get paid better. And if the reverse, then they're penalized. So 60% of employers and employees like value-based care. It's an American concept. But the question is down the details. What does that actually mean? So what we're seeing in the market now are providers that take risks, specifically from CMS. They're taking the risk, they understand there's risk, but they don't have a compass as to how to actually navigate that. And what AI does is gives that prediction of who those individuals will get worse in the future, who is going to be stable or possibly get better with chronic diseases, but also what's the next best action I need to take to get them better, so I actually know the course I'm going to do. And I think that's really the case for VBC strategically. Now, tactically, that VBC is tactical. I think the real thought leaders are now going from fee for service, or let's say semi-value-based care, and going all the way to risk. So if they have this compass and they have a roadmap through AI, then they're able to calculate what their risk is and put a better bet on that and look at those patients and say what that population is and then drive that forward.
Great. So what advice do you have for those who are trying to use AI?
Yeah, I think it comes back to, again, and you're going to build versus buy. And then also, if you buy, make sure you're with the right provider, right? And that you have a roadmap to operationalize that. Because we've all heard talk since 2017 about the rise of AI and how much great things it's done. And I'd argue that we're still saying the same thing. We still say will, and it's going to could, but actually, we actually have to do it. And, one of the catchphrases our marketing company came up with was, if we have the capability to utilize predictive analytics or predictive AI to drive better healthcare, then we have a responsibility to do so. And I think we've gotten to that point now where we have the technology, now we have to do it and we have to deploy it. And that's the tough part. So what we're seeing right now, so we're deployed in both insurance companies and clinics, and we're actually with the RN, we're with the physician and deploying that. It's more about making it accessible and easily digest to our caregivers and our licensed professionals so they can utilize this information to make better decisions. So they're not techie, right? So it has to be easily accessible, easy to use, and you need to simplify it. And if they want more information as to why that decision is happening, you have to give them that access as well. So,
Thank you so much for your time, Severance.
Hey, it's great to be here, Patty. Thank you so much.